You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Welcome back to the Mother to Baby podcast. Great to have you with us today. My name is Chris, and I'm a genetic counselor and a mom of three, and that includes two very opinionated teenagers and one very, very active toddler. So hello out there to everyone. Glad to have you with us. Today, we're going to be discussing the use of marijuana in pregnancy and breastfeeding, and that is a hot topic that has no indication that it's slowing down in terms of media coverage and also in studies. People are more and more looking at the potential effects of marijuana on pregnancy and breastfeeding. And one of the ways that we here at MotherToBaby keep up with all of the new, emerging, and changing information is we have an annual meeting. Once a year, we get together with our affiliates from all over the world to discuss current topics, new trends, and things that we think are going to be hot in the future. And marijuana consistently comes up as one of those topics. Interestingly, a couple years ago, we had our annual meeting in Denver, Colorado, right after recreational marijuana became legal there. And unbeknownst to me, I was actually about 6 weeks pregnant at the time, and we were just walking the streets, my husband and I, on a break. And I noticed that there were several dispensaries there. And so, out of curiosity, we just sort of looked around the area. And I was wondering, how would you know? If a pregnant woman went in to buy recreational marijuana, is there any real way to know? I mean, sure, sometimes you can see a woman's belly and assume that she's pregnant, but most people know that it's not really a good idea to ask a woman if she's pregnant, just in case she's not. And I have some friends who have some horror stories about things like that. But I was wondering, do they ask? Do they have to ask? Is that part of the law? Are they allowed to dispense to pregnant women, or is there something in the regulations that make that a no-no? Regardless of the answer, we do know that this is something that comes up pretty commonly. I mean, at MotherToBaby, we get calls and chats and texts about this all the time. And not only about, can I use marijuana, but is there a difference between the forms? Like, is it okay to smoke? And if it's not okay to smoke, can I eat it in a cookie form? Or can I have it in a mint? Or can I have some THC oil? And there are lots of different indications, not just recreational. And we think that it's a really interesting topic. I'm also really excited to have our guest professional here today. We have Dr. Christina Chambers. So you may have seen her or heard about her in the recent past. Her name was all over the news for quite a while because of a groundbreaking study that she had conducted looking at marijuana in breast milk. And before we get to Dr. Chambers, I just want to remind everybody, at MotherToBaby, what we do is we answer questions and we give information. We do have our toll-free phone service where we answer questions about medications and pregnancy, breastfeeding, pre-pregnancy, and adoption. We also have our chat and our texting services. And so in the spirit of what we do at MotherToBaby, we're going to open up the phone lines and let our callers have a chance to directly ask Dr. Chambers their questions about marijuana use in pregnancy and breastfeeding. On the phone with us, we have Jackie, a previous caller who is calling in again today about this topic specifically. Jackie, it's so great to have you back on the show. How are things?
Great, thank you. Thank you for having me back.
What is it that we can answer for you today?
As a medical professional in genetics, I work with a lot of pregnant women in many different stages of pregnancy or breastfeeding. And one of the questions that's come up recently is more about the medical marijuana. It's become legalized in some of the New England states. And, in the past, traditionally, we've cautioned women against using marijuana as we never knew how it was made, where it was coming from, and that was kind of an easy way to explain to patients why it wasn't necessarily a good thing for them to be taking. And now with some of the new legalizations and the more regulations that have been put on the marijuana, it complicates the conversation a little bit more. So I was wondering if you guys had any insight into how we could better address that.
I think that that is a really timely question because, as you say, legalization is becoming more and more prominent, and not just for medical marijuana, but also for recreational use. And as you know, those are two completely different ballgames. Being prescribed something for pain or nausea or, some other indication is much, much different than saying, well, I figure I'm going to have a THC cookie because it's legal now and I'm not going to get in trouble. And so, to help us address that question, we have our expert. I would like to welcome Dr. Christina Chambers. She is a professor in the School of Medicine at UC San Diego. She is co-director of the Center for Better Beginnings, program director of MotherToBaby, and is program director of Mommy's Milk, a human milk biorepository for research. With all these qualifications, we are very pleased to welcome Dr. Chambers to the show.
Thank you.
So, Dr. Chambers, we were hoping to get your insight and expertise about the use of marijuana in pregnancy and breastfeeding.
Well, thank you, Chris, for that question and for the caller bringing it up. I think that this is a really complicated issue and is becoming more complicated certainly as time goes on, and we see more states legalizing marijuana either for medicinal use or for recreational use or both. The question, I guess, that comes to mind is that legalization, sometimes we think because it's legalized, that means that it's safe. Or that because it's legalized, we know that it's tightly regulated and we know exactly what the content is and so on, which may be something that's reasonable to consider when you're talking about using marijuana recreationally or medicinally if you're not pregnant or breastfeeding, but it raises some other questions if you are pregnant or breastfeeding. So certainly from the standpoint, at least in my opinion, that more regulation is being introduced into states where it's legalized, that perhaps women who are using these products may know more about the content of what, for example, the strength of the THC that's in the product, but that doesn't answer the question about whether or not the product that they're taking introduces any kind of risk for the developing baby or the baby who's being breastfed. So I think that the issue that makes it complicated is that legalization doesn't necessarily mean safe for pregnancy, and that's a question that still needs to be answered.
That is really some good information to have. And I do think that people think, regulated, and when laws are passed, like you said, that there are more safeguards or protections, or it should technically be safer or something like that. And of course, we know that's not going to be the case. And, actually, we have another caller with us. We have Adriana. Adriana, are you there?
I'm here.
Hi, thank you so much for joining us today. How are you?
I'm great. Thanks for having me, Chris.
Oh, it's my pleasure. So, Adriana, are you pregnant? Are you breastfeeding currently?
Yes, I am currently breastfeeding.
What question can we answer for you today?
So this morning when I was getting up to have some quiet time before, the chaos of the morning, I just opened up the New York Times and there's debate about marijuana up, in New York and New Jersey.
Sure.
There's the ongoing debate about, marijuana and the legalization of it. So it's not going to go away. And for the friends in my circle, moms who are pregnant and nursing or trying to get pregnant, how do we process all this? So if someone is breastfeeding or wanting to get pregnant, is it safe to consume in any marijuana in any forms?
That's a good question. I appreciate you saying in any form, because as Dr. Chambers already mentioned, women may know the strength of the THC, but I wonder, and it sounds like Adriana is too, Dr. Chambers, if the strength isn't something where we can really say that would be compatible in that amount, is there a form? Does the form of the THC make a difference? Like if it's smoked or if it's in a cookie or in a mint or something like that, does that have any impact?
So that's a great question, Chris, and appreciate Adriana's question as well. When we think about the form of any kind of a medication or a drug or environmental agent, really the question you're asking is, if you use it in that form, how much of the stuff that's in it actually has the potential to get to the developing baby or the baby who's being breastfed. So it isn't so much a matter of the form, it's a matter of how much that you ingest or you smoke of the chemical that actually gets to the baby. So the dose to the baby is what we're concerned about. But the bigger question is, at any dose, does it matter? Is there a chance that an edible or a smoked marijuana, that the dose that you get of THC and the other cannabinoids actually can have an effect or interfere with the normal development of the baby? And that question is not completely answered. So we have some data from studies that were done many years ago, mostly, a few more current, that suggest that there can be some impact of using marijuana. Primarily, these studies have looked at smoked marijuana as opposed to other forms. But the studies, some of them have suggested that there may be an increased chance that the mother who uses these products might have a baby born early, might have a baby born smaller, and may have a child who might have some developmental problems, so some difficulties with learning or behavior as they get older. Not all studies have shown that, but some have. And to date, we really don't have, I think, in my opinion, good enough data to say if, in fact, the ingredients in marijuana, THC being one of them, can interfere with development of the baby, that there's a dose that is kind of what we call a threshold dose, that's an amount that would be so small as to not cause a problem. So we think that, if a drug is going to cause a problem, that naturally you would imagine that the higher the dose, the higher the risk. But in this situation, I think we just don't have enough data to say that there's an absolute confirmed risk for having the problems with the baby, with the pregnancy and with the baby, if you use cannabis products in pregnancy or while breastfeeding. And we certainly don't have a way of saying if there is a problem that there's a certain dose that above which you would tend to see those problems. So going back to your original question, I don't really think that there's a way to kind of differentiate between saying that the product that has that is eaten versus one that's smoked is more or less safe. We do think of this in terms of the amount, the dose that you might be getting, and this comes up, I know, from your callers all the time, Chris, the question about if you're using an edible product, for example, is it possible to get much more THC than the person is expecting because the drug kind of kicks in more slowly than smoking the product? And so is it possible that a mom who's using an edible product would get way more THC than a mom who's smoking it because she thinks that it's not taking effect yet? But still, in the context of things, we don't have a way of saying that one product is any safer than another at this point in time. Another consideration that's often thought about is potential effects of inhaling marijuana smoke, so similar to inhaling tobacco smoke, that there may be potential for reducing the amount of oxygen that's available to the baby, and certainly the amount of oxygen that the mother's intaking during pregnancy is important for the growth of the baby and for preterm delivery. Kind of an example of this is we think that mothers who have asthma that's not well controlled, they have really severe asthma in pregnancy, have a chance of having a child who's smaller and born earlier, and it's thought that likely has something to do with the fact that the mother's not getting as much oxygen as she would if she was had a healthy respiratory system.
When you were explaining the problems that occur when trying to determine if the use of marijuana is safe in pregnancy or breastfeeding, you mentioned cannabinoids and you've mentioned THC a couple of times. And so one of the questions that I frequently get on the phones is, okay, I know to avoid THC, but there's also something called CBD and cannabinoids and other ingredients. Is THC the only thing that they need to be concerned about? If there are CBD oil products that are separate products without THC, is that a similar concern to marijuana?
So, Chris, that's a great question. And I think the reason that THC comes up quite a bit is because that's what we call psychoactive ingredient in marijuana. So it's the thing that gives you the high. And from a theoretical standpoint, so thinking about how a chemical might get to the developing baby through the mother that could interfere with development of the baby, that translates to that baby having trouble learning and with behavior later on, you kind of think about agents that might affect the brain. If they're affecting the brain of the adult who's using the marijuana, may they also affect the developing brain of the baby? And so that's one of the reasons why THC is a focus in thinking about potential harmful effects during pregnancy. The other cannabinoids, like cannabidiol, that cannabidiol doesn't have psychoactive properties, may have some impact on pregnancy outcome. We just don't know. So I think it's probably not fair to say that one part of the product is harmful and another isn't. We need more research to know that if any of the ingredients are harmful or not, and if you are using a product that is a cannabidiol that doesn't contain any THC, is that perfectly fine? That would be a really important question to answer, but I don't think we have the answer to that question at this point in time.
Adriana, did that answer your question?
Absolutely, thank you.
Oh, our pleasure. And so do you have any other questions?
Actually, Chris, I do have another question. One of my friends was diagnosed with breast cancer, and she's being treated with marijuana, and I'm just wondering, if I go visit her, as a nursing mom, do I need to excuse myself?
And Dr. Chambers, I would like to add to that, if I may. If Adriana doesn't need to excuse herself from the room after her friend had been smoking marijuana, and for instance, her friend wanted to handle the baby or feed the baby, are there any other special precautions that need to be taken? So should her friend wash her hands or change her clothes? Anything recommended after the use of marijuana in smoking form and then handling a child?
So, Chris, that's a great question, and I think I'm going to step back a bit and talk about marijuana use in breastfeeding in general. So, if in this situation with Adriana's friend, for example, if Adriana's friend was the one who was breastfeeding and using marijuana, would there be concerns about the marijuana in her breast milk for that baby who's being breastfed? As we've said previously, we don't have enough research on pregnancy. When it comes to breastfeeding, we have almost nothing. So we have a little bit of data from older studies that have suggested both, yes, you can measure marijuana in breast milk. So, not surprisingly, it does go from the mother into the breast milk. So the baby is getting some of it at least. And some older reports have suggested that it may accumulate in the baby as well. So we know that marijuana products are like fat, or fat soluble, and breast milk is chock full of fat. And so that over time, if the mother's continuing to use, that the amount that gets into the breast milk may actually build up. But the question is, how much does the baby get from the breast milk? And does it matter? Does it cause any problems for that child? So the little bit of work that's been done on this has suggested that a very small amount, probably compared to how much is in the mother's bloodstream, is actually getting into the breast milk. But to my knowledge, there haven't been any studies that have looked at how much the baby's actually ingesting. So after the baby's breastfed, and say it's a 2-month-old who's only getting nutrition from breast milk, and the mother's using every day, does that accumulated amount also accumulate in the baby? So is the amount that the baby's getting more than what we might guess? So that question isn't answered. And we also don't have good data on whether or not even those small amounts, if they are small, cause any problems for the child. So that's a question that we've been working on through MotherToBaby to try to look at whether or not there's any impact of that at all. And it really is an incredibly important question. I know we've talked about the pregnancy question not being answered, and we've seen an uptick in the number of women using marijuana products during pregnancy with legalization and with the idea that maybe it is a remedy you can use for nausea and vomiting of pregnancy. But when we look at breastfeeding, I think that the numbers are probably even higher of women who use cannabis while they breastfeed. So that being said, we don't have good data on whether there are neurodevelopmental consequences. It's hard to study this, same as in pregnancy, because we're not, entirely sure whether the mother tells you in a study how much they took was actually what they took or what was in it. A couple of small studies have been done on 1-year-olds that looked at moms who were breastfeeding using marijuana or not. One found no difference in the children, and another found that the children who were being breastfed by mothers who were using marijuana were slower in their motor skills, so sort of their movement. And these were done 20, 30 years ago. So again, kind of a big void of data.
And Dr. Chambers, if I may interrupt, I know that you recently had a very popular study published. It was in the Chicago Tribune, it was on CBS News and CNN, talking about how long marijuana actually stays in breast milk. So much longer than we originally thought. Is that right?
Oh, yes, it is. This was a study that we did about a little less than a year ago with some volunteer mothers who were nice enough to contribute samples of their breast milk and to tell us about how often and how much marijuana they consumed over the previous 2 weeks. So it was about 54 samples from 50 moms. And what we did was, with our colleagues in the School of Pharmacy here, is measure the amount of the different cannabinoids that could be measured in the breast milk to see how much was there. And we were able, in a little more than half of those samples, to detect THC, so it was measurable. We found that even if the last time at least one of the moms had used marijuana or reported using marijuana was up to 6 days ago, we could still detect THC in some of those samples. So it suggests that it hangs around. So, but still, that study just raises the question of, if it's there, does it cause any problems for the child? And that's something that we're pursuing, trying to answer now, following up on those kids to see if there's any differences in growth or their learning and behavior as they get a little bit older.
And I think it's really great that you have participants in a study like this, because I'm sure you're aware, and I'm sure our listeners are aware, that, you know, in every capacity, there's at least some level of stigma around marijuana use, whether it's recreational or for medicinal or therapy purposes. So it's really encouraging that you have women who are willing to give you this information, give you their breast milk samples, and then to allow you to examine their children, which really is helpful not just to them, but also to, you know, future generations of pregnant and breastfeeding women.
I agree. If they didn't volunteer, we would never get the answer to these questions.
Yes, and I would, you know, give a shout out to not just these women that you've encountered so far, but also all the other women who have participated in all the other studies that you have been a part of in the past, and other members of our organization have been part of. Like you said, without the volunteers in pregnancy and breastfeeding, it's very difficult to get this information. So we're all really grateful that we have data based on the availability of moms in the past.
Agreed.
Okay, so not to get too far back, we didn't forget about you, Adriana, I promise. So Tina, if we can, so anything special that her friend would need to do if she smoked and then wanted to handle Adriana's baby in any way?
Yeah, so I kind of think of this as similar to tobacco smoking. So if you're a breastfeeding mom, you don't, or pregnant or breastfeeding, but certainly a breastfeeding mom, if you have someone in the household who smokes, you would want to avoid being around that person while they're smoking. Again, it goes back to the question of the dose, and certainly we think that a small amount of THC at least is likely to get into breast milk. The idea that the friend should wash your hands or change your clothes, that all of that would be on the side of saying, should we be, you know, as cautious as possible in not wanting to expose this infant to any cannabis product. And so I guess that would be a personal choice as well as to whether or not you would go to that extent. But if you have any question at all, which I think we all do, about whether or not marijuana may have any potential to be harmful, then that might be a choice that you would make.
So in this situation, it would be pretty difficult to be too cautious. Okay, well, we're coming to the end of the broadcast. So as always, listeners, thank you so much for being with us today. I think we had a really great session with Jackie and Adriana and Dr. Chambers. And actually, it seems we may have one additional guest. If you remember earlier in the podcast, I mentioned that when I was in Colorado for a MotherToBaby meeting that I was newly pregnant at the time. And it seems that my toddler has just made an appearance on the show. So everybody, I'd like to introduce you to Arthur. Yep, that's Arthur. He's trying to grab my headphones just for a visual effect. Can you say hi? Can you say hi? Well, not everyone is made for radio. Okay, so as a reminder, if you ever need or want to contact MotherToBaby, you have several ways that you can do it. You could always visit us online at mothertobaby.org. You can reach us by phone at 866-626-6847. You can reach us via text at 855-999-3525, and we also have a free app available. Well, that was Arthur saying goodbye as well. So until next time, remember, MotherToBaby's here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit mothertobaby.org.